welcome to the Children's and Teen Health Summit. I'm your host, Carla Atherton, founder and director of the Lotus Health Project, lotushealthproject.com, where we empower people to get healthy and stay healthy in mind, body, and spirit, and on the social, global, and environmental levels. For this session of the summit, I'm excited to be speaking with Dr. Liz Lipski about digestive wellness for children and teens. Dr. Lipski holds a doctorate in clinical nutrition and is board certified in clinical nutrition, holistic nutrition, and as a certified nutrition specialist. Dr. Lipski is the Director of Academic Development for the MS Postmaster Certificate and doctoral programs in nutrition at Maryland University of Integrative Health. She co-teaches the GI module at the Institute for Functional Medicine and collaborates with the Autism Research Institute. She is the author of Digestive Wellness, The Digestion Connection, Digestive Wellness for Children, and Leaky Gut Syndrome. She has been working in the field of integrative and functional medicine for over 30 years. She offers webinar-based mentoring programs and advanced nutrition forums for nutritionists, dietitians, and other clinicians through Innovative Healing, Inc. She resides in Laurel, Maryland. Welcome to the summit, Liz.
Hi, Carla. Thanks for having me.
Oh, so great to have you here. I'm just gushing and excited and can't wait to get into all these topics, this rich information that you're just about to share with us. So welcome, welcome, welcome.
Thanks.
Okay, so let's just get right into it. So, your topic here today is digestion, and it's often overlooked as an issue of importance in the scheme of things when we think about our health and our children's health. And, we can get caught up in addressing symptoms and conditions without really thinking about what is causing these problems for ourselves and our kids in the first place. And so many of us are very far removed from what is going on in our digestive tracts and those of our children, but really, digestion is at the very root of our health. Would you agree, Dr. Lipski?
I do. When we think about food and nutrition, we mostly think about what we're eating. And sadly, so many people don't really give a lot of attention to the type of food that we eat. And a lot of it is actually not food. It's a food-like substance, as Dr. Michael Pollan likes to say.
All right.
And but the function of digestion is actually to take that food and turn it into nourishment for every single cell in your body. Mm-hmm. So when digestion doesn't work right, nothing works right because the cells are suffering for what they didn't get, or maybe they got food like substances that actually weren't good for them, that cause inflammation and cause them to short circuit. And so when digestion doesn't work right, then we don't think right. We don't have the right energy. Our joints don't work right. Our skin's not right. I mean, there's nothing that works if our digestion isn't working.
Okay. So so let's back up and let's just do the basics of digestion just for a couple minutes, just to give an idea of what is going on when you digest your food. And some people might, already know this, but some might just actually really haven't paid attention to that before and not really know what the mechanisms are and what's happening when you actually digest your food. So can you just go over that quickly, just to get it, start us off?
Sure, I'm happy to.
Okay.
And I think a lot of people don't really know. First of all, we don't even notice digestion unless it isn't working right.
Yeah.
And then when it's not working right, usually there's some discomfort associated with it. And then all of a sudden, we're really paying attention. And not only for ourselves, but for our children. And most children will just kind of say, oh, my tummy hurts, mm-hmm. or they'll gesture that their tummy hurts, or you'll hear them having gas, or you'll see that they're constipated or have diarrhea. So, there's kind of outward manifestations of that. Let's kind of talk about what's really happening. The process of digestion begins when you start thinking about what you're going to eat. Your body starts preparing. Mm-hmm. So we have this kind of what we call the cephalic phase, where we're starting to really think about what we're going to cook, or we're going to a restaurant, or the food's starting to smell good, and we're starting to think about what we're going to eat. And our body starts to prepare for digestion right then. Yeah. And then when we sit down to eat, and I hope that we're mostly sitting down to eat, what happens is that digestion it really runs on the parasympathetic nervous system for a large extent, which is kind of that relaxation mode. And it's one of the reasons why sitting down at a table is important, why saying grace or taking just a couple deep breaths to be thankful for the food that you're eating. Why that's also important is because it sets the stage for you to actually be able to digest your food better.
Mm-hmm.
So all that starts before we've even taken a bite. And then we take a bite of food, and the beginnings of real digestion start in the mouth, where we have these white, shiny things called teeth that are there to actually chew our food, because it makes the process of digestion so much easier, because you don't have to work so hard once the food gets further down.
Mm-hmm.
So there are a lot of people who, and adults and children, who, if they just slow down and chew their food and don't just wash it down with liquids, they're going to have better digestion and feel better. So that's the first kind of tip, is chew your food. So then as we swallow that food, it goes down the esophagus, and the esophagus is kind of this, just piece of this hose that runs through us that's about 25 feet long that we call the digestive system. And the purpose of the esophagus is to get the food to travel down to the stomach. And the problems that we have in the esophagus are that sometimes the little round sphincter valve, which is a muscle kind of like your anus or your mouth, it's a little round muscle, and it opens and closes between the esophagus and the stomach. And some people, that sphincter gets inflamed or irritated, and so they can have stomach acid that's supposed to be in the stomach. It backs up into the esophagus, and we get what's called heartburn or gastroesophageal reflux disease, to give it a big fancy name of GERD. So the stomach has really important functions. Main functions of the stomach are to mix up and act as a blender, to really blenderize our food so that by the time it goes into the small intestine, it's really a mush. And in that mush, in the stomach, there's this hydrochloric acid, and the hydrochloric acid serves to do a bunch of things. First of all, if you've ever eaten something that was a little bit off, or had a little bit of mold on it, or maybe had a bacteria on it or a parasite on it, the hydrochloric acid is pretty strong. And it really strong, like if you got it on your hand, it would burn you. And if you take in one of those things, it's supposed to kind of knock it out so it becomes harmless. The second thing that the hydrochloric acid does is it starts breaking down, along with gastrin, starts breaking down proteins and cutting them into chunks, because our proteins can come in amino acid chains up to 20,000 units long. And how we end up using them is 1 and 2s, or peptides, which are like 5 together. And so breaking that all down, it begins the process of like ripping our proteins apart so that we can use them. And also what happens in the stomach is we secrete something called intrinsic factor, which allows us to absorb vitamin B12 from the food that we eat. And B12 is a really important nutrient because it's important for energy production and strength, muscle strength, and so many other things, nerve function. So it's important that we have this all working right so that we can absorb protein, also absorb vitamin B12. Once the food is in a form called chyme, which takes about anywhere from 2 to 4 hours, the food moves from the stomach into the first part of the small intestine that we call the duodenum. And it's about 12 to 18 inches long. And it's really important because this is where a lot of the digestive action happens.
Okay.
Because we have all this hydrochloric acid, most of our minerals, calcium, magnesium, zinc, potassium, manganese, they're all absorbed. They're absorbed best in the presence of acid. And so with the acid being there, we end up being able to absorb our minerals. Also, what happens is that the acid has already done its job. So for the rest of its trip down the small intestine and the colon, we don't need that acid beyond those first 12 to 18 inches of the small intestine, which is about 15 feet long, 15 to 20 feet long. So we don't need it anymore. It's just going to burn things. So with that, what happens is that the pancreas secretes a couple of things. One is basically baking soda, and it neutralizes the acid. And it also secretes enzymes that break down fats, proteins, and carbohydrates so that we can actually digest the food now that it's in the small intestine. So that's the next thing that happens. And also the liver produces bile. And so when we eat something that has fat in it, the liver and the gallbladder release bile into the small intestine through the common bile duct, just like the pancreas releases enzymes and bicarbonates through this small bile duct. And so that we can start emulsifying our fats. What bile is, it's like soap. And so when we're washing a greasy pot, we use soap on that. It doesn't actually get the grease off. What it does is it emulsifies it so that instead of being big molecules, they're teeny, teeny little molecules and they can wash away. And the bile helps us to break down our fats that we've eaten into tinier molecules so that we can more easily digest those.
Ooh, what a great way to explain that.
So then we've got all this happening, and now all that food is in the small intestine. The acid neutralized, we have enzymes, we have bile, and now we're really going to town to digest all that food. And most of our minerals, vitamins, get absorbed in this small intestine area. Vitamin B12 and a couple other things get absorbed best in the colon, but most everything gets absorbed in the small intestine. And so those enzymes and the bile work on the food that we've eaten to break it down into teeny tiny little molecules that can go into our bloodstream. So the lining of this small intestine is 1 cell thick. And if you could look at it, it looks a lot like a towel. It has millions of little tiny loops on it, and those little tiny loops all have little tiny threads on them. And the cell itself is called an enterocyte, and the big kind of loops are called villi, and the little tiny ones are called microvilli. And that's really the absorptive surface of the small intestine, where we absorb all these nutrients right into the bloodstream. And if you could spread all those little loops and little hairy loops out flat, it would cover the size of a doubles tennis court.
Wow.
It's big. It's big. Okay. So it's really important that that's working right. And those little cells of the small intestine, they repair and replace themselves every 3 to 5 days. They're brand new. So we have a lot of problems that can happen right at this barrier where we're absorbing the food in, and we can talk more about that later. So then what happens to the food is 2 things. One is we actually absorb it into our bloodstream. It gets carried into the bloodstream to every cell in the body so that every cell gets the right nourishment. And that's really the goal of digestion, is to have that happen. That's why we eat. It's not because it's fun. It's not because it tastes so good. It's really because without it, we're, not here on this earth very long. So the other thing is that there are some things that the small intestine says, you don't belong here. And we're going to just let you keep passing on through because you are not a friend. And so So those things pass through and they go into the large intestine and we poop them out.
Mm-hmm.
And we'll talk more about that. Also, in the small intestine, and large intestine, we have 3.5 to 4.5 pounds. So that's like 1.5 to 2 kilos of bacteria, viruses, yeasts, and they function as our most active organ. They're about as big as our liver, and they're a whole new organ system that's really just being developed and researched and known about.
Mm-hmm.
And because they're so tiny, nobody ever really gave them much thought. But these bacteria, mainly bacteria and yeasts and a little bit of viruses, they actually control our metabolism, determine whether we're healthy or not, determine how well we make B complex vitamins. They manufacture vitamins for us and vitamin K. They also manufacture little bits of anti-cancer substances and little bits of antibiotics. And they really modulate our immune system. And so 2/3 of our immune system is actually located inside the digestive system.
Mm-hmm.
We call this the gut microbiome or the microbiota. And the research is so new on it, but and also very, very exciting.
It is.
And why so much of the immune system is in the digestive system is because every day we take in pounds of what we call food, and the body has to decide, is this friend or foe?
Mm-hmm.
And is this dangerous or not?
Yeah.
And so that's the function of the immune system. And in comparison to the, almost a ton of food that we eat in a year we take in about 1 teaspoon of pollen and dust. And we know how sick that little amount of pollen and dust can make someone. So think about eating the wrong foods, almost a ton a year, what that can do. So that's why most of the immune systems in the digestive system.
Mm-hmm.
Also in the digestive system, we make all of the same neurotransmitters that we make in the brain.
Yes.
And we make 80 to 90% of our serotonin in our gut, not in our brain. And pretty much everything, dopamine, pretty much every single neurotransmitter, we make plenty of it in the digestive system. And a lot of that is still being researched as to why. But we know, for example, serotonin works on gut motility, how fast or slow that food actually moves through your digestive system.
Mm-hmm.
So then, let's see, we move into, once all of the nutrients have been absorbed into our bloodstream, we move down into the colon. And the colon has a lot of functions. Its job is to remove wastes. It's also to recycle pretty much anything you can still use. So if we didn't have a good operating colon, we would have diarrhea and we would need to drink about 4 gallons of water every day. So we recycle water, we recycle minerals, we recycle pretty much anything we can to use it over again. And then, of course, we have bowel movements and we get rid of the wastes. And so that's a very kind of quick trip through the digestive system. And understandably, you and or your kids can have problems that happen pretty much on any part of that system.
Excellent description. Thank you. So we usually see the digestive system as, like most people say, okay, you absorb your nutrients by breaking down your food, but there's way more to it than that you mentioned, that the neurotransmitters are made in that digestive system and also the immune system is, I guess, what would you call it? Not regulated, but it's part of our immunity lives in the gut. How would you explain that? Sorry. How did you word that?
About 70% of our immune system is located in the digestive system.
Yes. Okay.
And most of that is really regulated by the gut microbiome.
Okay. So we'll probably return to those points, but just to reiterate that there's way more to the digestive system than we think. And that's why it's so key to our overall health and our kids' health. So again, when we think about digestive issues, we most often think about, like diarrhea, bloating, those telltale signs, right? Constipation, our kids have a tummy ache. And can you explain some of these conditions that often occur in our children and teens with regards to those things that we usually associate with the digestive system?
That's a big
I
question.
know. Okay, how about we pick a couple?
Sure. Okay, so first of all, the common kind of things are diarrhea,
Hmm.
constipation. So let's just start with constipation. When babies are born, if they're breastfed, they have this kind of sweet yellow poo that doesn't smell bad and it's kind of nice. As soon as we start eating real food, we have, poo that's brown and doesn't smell that good. And it's normal to have at least one bowel movement every single day.
Hmm.
Now, what's normal for one person might not be normal for another. However, to me, what's normal is somewhere between 1 and 3 bowel movements a day.
Hmm.
I've worked with kids and adults who have one bowel movement a week
Yeah.
or less, or use laxatives in order to have bowel movements. So, um, the typical, North American person doesn't eat enough high fiber foods. We get about half as much as we need. So, the simplest thing in terms of constipation is, are you getting enough fiber in your diet?
Mm.
That's the beginning question. So, are you eating fruits and vegetables? Are you eating whole grains? Are you eating um, beans and lentils? Because all those foods have a lot of fiber in them. And probably if I had to pick any one group, it's beans and lentils have the most fiber and kind of do so many things for your body. The second thing that I start thinking about is activity. And most kids are naturally active. So
Hmm.
that's not generally an issue for kids. If you try just being as active as your kids, I was driving down the road and there were kids, they just ran across the street. It's like, well, we don't run as adults very often. Kids just move. They move in
Yeah.
different kinds of ways than we move.
Yeah.
So movement usually isn't a problem for kids. And then the next thing I look to is, are they getting enough fluid? Are they drinking enough water? Are they eating enough watery foods like watermelon and fruits and vegetables? Cottage cheese, things like that. So, and then the final thing that's general that I see over and over and over again, and I don't know all the Canadian statistics, but in the US statistics, the average American gets, only half of us get enough, less than half of us get enough magnesium every day.
Hmm.
And magnesium is one of the nutrients that really keeps the digestive system working right and keeps that movement going. And so, if all else fails, thinking about high magnesium foods, which are green leafy vegetables like broccoli and kale and chard and romaine lettuce, and also whole grains again. So, and possibly taking supplements. Like I take a magnesium supplement every day, which keeps my muscles relaxed and helps me sleep better. And some of the other signs that people might not know, other than constipation, would
Hmm.
be things like your muscles feel tight and tense. You're very sensitive to noise. You startle easily if somebody slams a door, walks behind you.
Hmm.
You Women have menstrual cramps. Kids have leg cramps, and Charlie horses. Your eyelids twitch. You have other kind of muscle twitches or cramps. And you don't need all of those, but they're just signs that you might need more magnesium. So I think there's certainly a lot more in my books on constipation, but that's kind of a broad overview that'll help most people.
Before you leave the issue of constipation, I just want to say, like, can you speak to the danger of constipation? Because we think, well, it's uncomfortable. It's not a fun thing to go through, but it's actually the stool itself, like because of that, the body's desire to recycle and reabsorb. When that stool sits there, we retoxify our bodies. Can you talk about that just for a second?
Sure, you did a good job though.
Oh, thank you.
So we start reabsorbing hormones that we got rid of. We can reabsorb toxic chemicals that we got rid of. The bile can be actually irritating, and actually constipation can be a sign of small intestinal bacterial overgrowth. It can be a sign that you actually have an infection that's causing it. One of the consequences that is well documented is that when we reabsorb estrogens and certain hormones, that constipation, chronic constipation, is associated with higher incidence of hormone-dependent cancers, like breast cancer and ovarian cancer. And so when we start looking at it, it's not entirely benign. And bacteria multiply. Most of the kind of activity of what's going on in a bacterial way is in the digestive system is happening in the colon. So we want to make sure it's really working right. And and diarrhea, on the other hand, is just the opposite. We have such watery stools that we're not actually absorbing the nutrients that we ought to be absorbing. And so we want to see kind of a balance there. And, having a bowel movement, it should be an easy thing. There should never be pain or blood or mucus or discomfort. And if you're having bowel movements, or your kids are having bowel movements that all of a sudden after they poo, they feel like, oh, now I feel okay. There's something going on, it's so looking for yeast overgrowth or bacterial overgrowth, or to look further upstream are they moving enough? Are they getting enough fluids? Are they getting enough fiber? Are they getting enough magnesium? Do they have some probiotic rich foods in their diet? All these things are so important. And nobody talks about it. One of the really kind of fun experiments that you can do is take some charcoal tablets or eat a whole bunch of corn and see when you see it come through in your stool.
Right. Or beets. Is that another good way to test your the transit time?
It is. I just ate that. I was eating beets. I had beets like 3 times in a row, 3 meals in a row. And I went, oh, I can't wait to see these poos. But not everybody will see the color from beets, but most people will. And if you see this kind of, red color of your stool, that's what you're looking for. And, optimally, people will, from the time we eat something till the time it passes through, should be, 18 to 24 hours. Yeah. But on the average, we North Americans, it's more like 72 hours.
Okay. Good info. Okay, so and what about like things like gas? That's not a good sign.
Well, first of all, everybody has gas.
Yeah.
Yeah, I read this study a long time ago about somebody had people record how often they farted in a day.
Okay.
And the average person, it could just be a little silent thing, but the average person, I think it was like 12 times a day. It's like people do release some gas, and a little bit of gas is pretty normal. However, now that I'm saying that, you don't want to know this, but I think I'm way below that average. So the thing that we need to know about gas is that gas is about us actually fermenting foods, and the human body the human cells in our body don't have a way to ferment foods or manufacture gas. What's doing that is those gut microbiota that I was telling you about. And when we're getting a lot of gas, it says that microbiota is out of balance. We either have bacterial infection that might be very low grade, yeast or fungal overgrowth, parasitic overgrowth, or that we're just not able to, that we're not digesting our food very well. So, taking probiotics can actually help that, or eating probiotic rich foods. Like homemade sauerkraut or pickles or yogurt or kefir or naturally processed cheeses, old-fashioned kind of cheese.
And with the fermented stuff, I just want to add that you want fermented. You don't want like pickled in vinegar. You want fermented foods. Is that correct? Okay.
Correct. So Like I just bought some little cucumbers, and when I go home today, I'm gonna ferment them, and I'm going to take them and put them just in a jar with some salt water.
Mm-hmm.
And I'm going to put some dill and garlic and dill seed in there, and let them sit for 3 or 4 days, and then I'll have pickles.
Right.
And they're effervescent. They almost taste carbonated. They're so yummy.
Yeah.
Really simple to do. Or I just finished a batch of homemade sauerkraut, which is, again, so simple to do. You just kind of take cabbage and salt, and you just kind of crunch it and then put it in a jar, weight it down, and let it sit for a few weeks. So, it's easy to make those. Most of the pickles and sauerkraut and things that we buy have preservatives in them.
Mm-hmm.
And so they're less, the bacteria in them aren't alive. Also, we get really good probiotic bacteria just on the fruits and vegetables that we eat, which is why you can take cabbage or cucumbers or other vegetables and actually put them into a saltwater solution and have them turn into a fermented food, because the bacteria are already on the food. So just eating lots of fruits and vegetables is something that helps us keep our gut microbiome healthy.
Okay. And I interrupted you. Were you on a train of thought, or should I keep going?
Whatever it was, it's gone. That train left the station.
Oh, okay. Okay, so, maybe we can touch on a couple of these other things that, kids can get diagnosed with certain things from their doctors for things like inflammatory bowel disease, let's say, or inflammatory bowel syndrome. Is there a difference between the two? Actually, it was one of my questions, but can you kind of give us a little bit of information about what those kinds of syndromes, I'm pretty sure that they're all a little bit different, but maybe pick one or two that you can explain to us a little bit more in detail?
Sure. So, inflammatory bowel disease is a pretty serious disease. And if your child gets diagnosed with that, it's something that is a lifelong condition.
Mm-hmm.
And they're pretty much autoimmune, and they flare. So they go away and they come back under times of stress. And diet plays an enormous role in actually modulating that and helping prevent people from recurrences of it. So there are incredible diets that are restrictive of carbohydrates
Mm-hmm.
that are being used to control those diseases with great success. And like specific carbohydrate diet, the gut and psychology syndrome diet, which is called the GAPS diet, even an Atkins diet or any Paleolithic diet can be very, very useful for people with inflammatory bowel disease. Irritable bowel syndrome is something quite different, and it affects about 14% of our kids. And what it is more about what we've just been talking about. It's kids who are chronically constipated. It's kids who have diarrhea, who have alternating constipation and diarrhea. Kids who complain of gas and bloating and that their tummy hurts. And then they have a bowel movement and then they feel better. Those are the signs of kind of irritable bowel syndrome. And that condition happens for a lot of different reasons. It could just be that somebody's lactose intolerant or casein intolerant. It could be that they have undiagnosed celiac disease, or that they're gluten intolerant. It could be that they have another food intolerance or food sensitivity. You could also have somebody who has, in over half of people who have irritable bowel syndrome, they actually have a slow growing bacterial infection called small intestinal bacterial overgrowth. And when that's treated with herbs, diet, or antibiotics, they're healed. And it's so important because IBS, when you compare IBS to other kind of chronic health conditions, it ranks up there with people who have cancer and are on chemotherapy as affecting lifestyle just as much. So, it's a really big deal. And it's not just about eating more fiber. It's really about looking at all those other pieces And for some people, because we have so many neurotransmitters in the belly, for some people, that irritable bowel syndrome has to do with neurotransmitter balance as well. We've all heard that you can have butterflies in your belly, or we all know people who, before they have to give a talk in front of people, they have diarrhea or they throw up. So you start looking at that and you're going, well, stress also plays a role for some people where we can't find any other reason. So there's a lot to look at there. So that's those conditions. What interests me, and I'd really like to talk about a little bit about our kids, is the things that we don't consider to be digestive.
Yes, please do. Let's get into that.
Okay, so some of the things that we see on our kids is eczema, psoriasis, headaches, juvenile arthritis, autoimmune conditions like juvenile arthritis or type 1 diabetes or lupus, celiac disease. There's so many other kinds of conditions that we don't necessarily think of as being digestive, but can be. Even asthma has a role, or attention deficit hyperactivity disorder plays a role. Bowel or urinary incontinence, where kids just aren't potty trained, even though they're past the age where they should be.
Yes.
You want to start looking at food sensitivities, and you want to start looking at something called leaky gut or increased intestinal permeability. Remember when I was talking about how the enterocytes are like a towel, and they're only one cell thick, and they replace themselves every 3 to 5 days. Well, when we're under a lot of stress, or we're eating a lot of junk foods or a lot of sugars, or our kids have been on antibiotics, or our kids have been put on acid blockers because they have GERD, what happens is that those cells of the small intestine don't replace themselves. And when they don't replace themselves, then food molecules, viruses, bacteria, pesticides, herbicides, chemicals that aren't supposed to get from the small intestine into your bloodstream, they just slip right in, because you're no longer using a colander anymore. You just have an open tube. And so all that gets into the bloodstream, and the body, depending on your genetics, will register that either in your brain or in your skin or your lungs or in your digestive system or wherever, in your nervous system. And so people can feel depressed from it. They can have ADD or hyperactivity. You can have a kid who can't think straight, or an adult who can't think straight. You can have somebody who represents it as migraines, and another person is eczema, and another person is arthritis, and another person is autoimmune conditions. So we know that, for example, with almost every single autoimmune condition, you have to have this leaky gut.
Can you say that again? Because I think that's a huge, like, I guess discovery, a point of interest that people are starting to really research nowadays, that leaky gut, that's a criteria for having an autoimmune issue.
Correct. And we don't have every single of the 80 autoimmune conditions studied yet, but actually all of the ones that have been studied, leaky gut is one of those predispositions that has to occur for you to develop an autoimmune disease.
And autoimmune is when the body sees something in your blood that it attacks it. So when it attacks something foreign in the blood, correct me if I'm wrong, then it also can see things that are supposed to be there, like pancreatic beta cells, and they look similar, so they start attacking its own cells. So it can happen in many different body systems, and I'm just using the pancreas as an example. But is that correct? Is that how autoimmunity actually works?
It is. You did a good explanation of it. If you think of antibodies are something that we produce in response to a foreign substance that we call an antigen, and it can be almost anything. And they're like keys and locks. And while it's not that likely that if you take your key and you put it into your next door neighbor's front door, that your key's going to open their lock,
Mm-hmm.
your key's going to open somebody's lock. And nature has made antibodies so that they're not a limitless amount of them. And so some of them cross over. And so you'll see that an antibody that you would use against a bacteria, for example, a bacteria called Klebsiella pneumoniae, which in most people, when it really takes hold of them, it will cause pneumonia in your lungs. But for people who have a certain genetic type called an HLA-B27 genotype, when they have a certain genotype and they get exposed even in small amounts to this bacteria, what can happen is if they also have a leaky gut,
Mm-hmm.
it triggers a mimicry that's called ankylosing spondylitis. It's a type of arthritis that happens mostly in boys and men.
Mm-hmm.
Unlike a lot of autoimmune diseases happen more in women. So it's one of those really interesting pieces where we're starting to see more and more and more diagnosis of autoimmune conditions. In fact, Dr. Mark Houston, who's um, a cardiologist and surgeon at Vanderbilt in Tennessee, he believes that the cardiovascular disease is also an autoimmune condition.
Wow.
Pretty much any tissue in your body can be something that your body starts attacking
Mm-hmm.
because it's similar to something else it's trying to attack.
Right.
And we call it as a molecular mimicry.
Mm-hmm.
And so you can go after um, your parietal cells in your stomach that produce hydrochloric acid and produce that intrinsic factor. You can go after your joints. You can go after your brain, or really any tissue in your body.
Wow.
And they're on the rise. When you look at charts of autoimmune conditions, they're just skyrocketing. And I think so much of that is from not really, it's multifactorial. I think it has to do with all the crummy quality foods that we're eating, all the processed foods. I think it has to do with epigenetics and the genetic tags that we put from generation to generation, because we're now 3 to 4 generations into kind of this highly processed food. It has to do with the introduction of so many antibiotics in agricultural production and hormones used in agricultural production, which end up inside of us, which disrupt our gut microbiome. It has to do with the widespread use of antibiotics in small children and other drugs that we haphazardly just give to kids, because we're setting up this kind of microbiome defense the first few years of our lives. And if we disrupt it, we can disrupt it permanently. And I think EMFs and from cell phones and all the wireless devices and towers, I think also the genetically engineered foods, we have so many things that are so different that contribute to this. And like you brought up type 1 diabetes, where the pancreas is the tissue that's affected.
Mm-hmm.
And we know, like in many of these conditions, like type 1 diabetes, there's always a trigger. And in type 1 diabetes, often that trigger is that a child will get a cold or a flu that just looks like a normal cold or flu.
Yeah.
And then the next thing you know, their pancreas isn't working right and they're type 1 diabetic. And so there's always a trigger. Like with celiac disease, we see people who are eating gluten. Usually there's an additional trigger that makes that leaky gut happen in addition to just eating gluten.
Mm-hmm.
It could be an infection. It could just be stress. It could be almost anything. And we see this over and over and over again in autoimmune diseases. So it's really important to kind of look back and try to figure out what that trigger was and see if that trigger is still affecting us or not. And the great news about autoimmune diseases, even type 1 diabetes, is that it's kind of like, you know, in our homes, we have electrical switches and we can turn them on or off.
Yeah.
And on autoimmune disease, I compare more to a dimmer switch. You know, you can turn it on and off, but mostly we turn it up and down.
Right.
And so with autoimmune diseases, by changing our diets and by changing lifestyle and by reducing toxic exposures, we can dial those way down so that they give us less problems over time.
Yeah.
And the answer may include medications, and it always includes changes in lifestyle, and not only looking at what's going on in our physical body, but looking at the emotional body too. Kids who have chronic issues have to mature really fast because they need to ask kinds of questions that other kids don't have to ask. They're often, like, for example, with type 1 diabetics or kids with asthma, they're often in a life-death situation almost. And so they grow up very quickly. And I think that, and I really believe that counseling, acupuncture, energetic healing modalities like Reiki or emotional freedom technique, shamanism. We're really going off the wall here. Homeopathy,
meditation,
meditation.
yoga.
I think all these things are so important to all of us, and especially to kids who have, you know, chronic illness, to try to look at some of the non-physical aspects to the illness is so important.
Excellent point. Excellent point, Liz. Okay, so I think that, I mean, you've done an excellent job of explaining autoimmunity and the connection to a leaky gut. Can you go into a little bit more, you know, something like ADHD that you mentioned in the list of those sort of conditions that we find that's become very prevalent in our children and teens nowadays, like how ADHD can relate to gut health?
Sure. Well, again, it's not a one size fits all. So it's important to find somebody who can work with your child or you specifically to try to figure it out. So in the autism community, we say, if you've met one child with autism, you've met one child with autism. If you've met one kid with ADHD, you've met one kid with ADHD. I mean, they're different. So some general guidelines would be, one is that most of them do have leaky gut. And they have leaky gut, which can mean leaky skin, leaky lungs, and also leaky brain. And so those food molecules are getting everywhere. And so we look at food sensitivities pretty dramatically. I'll tell you the story about this one 12-year-old boy that I was working with. And his parents owned a coffee and ice cream and cookie store. And so pretty much he ate a lot of ice cream and cookies. And he had a terrible diet. And he also had horrible ADD and ADHD. He couldn't focus, he couldn't concentrate. And so what I said to him was, let's do an elimination diet. You're 12 years old. Let's have you eat foods that are going to be good for you. Let's have you eat fruits and vegetables and chicken and fish and lamb and bison. And you can have some olive oil and coconut oil, and you can have herbs and spices, and you can have rice and millet and quinoa. And let's do this for 2 weeks and just see how you feel. But no sugar, no eggs, no dairy, no preservatives, no additives. Let's just kind of look at that and just see how you feel. So he goes on this diet, and we made a deal, which I don't always do, but with a 12-year-old, I'll often make a deal like this. And I said, so Sunday through Friday, you eat my way. And on Saturday, you can eat all the cookies and ice cream you want. Whatever you want to eat, you can do that. Because what you'll often see is what we saw in this little boy was that his behavior was completely out of control. So he
Mm.
did this for 2 weeks. And on the second week, he went to a birthday party on a Saturday. And he had 2 pieces of cake and 2 servings of ice cream. And his behavior was so horrible that they asked him to go sit outside.
Oh, wow.
So, as a 12-year-old, he was able to actually see the relationship between his behavior and the food that he ate.
Mm-hmm.
And as a 12-year-old, he could actually make this decision to try to do this. Now, did he need to be off of all sugar and all additives and everything forever? No. What we started doing was adding foods back in slowly to see what made him have this kind of reaction.
Mm-hmm.
I was working with a 7-year-old girl who had every single day, she had to still wear pull ups because she was peeing and pooing every day
Mm-hmm.
in her pants. And she also had horrible behavior. And so, again, we put her on an elimination diet for 2 weeks. We didn't give her the Saturday option. And within 2 weeks, she was having no more bladder incontinence, no more pooping in her pants. And her behavior in school and at home had improved so much that everybody noticed it. And in fact, I wanted to do a lot more with her and her parents to really kind of keep looking and refine this. They were so happy that they just kept her on this diet long term.
Wow.
And I also had a little girl about 12 years old who came into my office one day and she said, if I have a single yellow M&M,
Yeah.
I will go into epileptic seizures on your floor
Whoa.
within about 15 minutes. So, we have to look at what we're putting into our kids' bodies and clean it up. And it's just amazing. Then, there are kids who won't respond just to a diet change, but most kids will. There are supplements like pycnogenol and fish oils and other things that may be helpful. Healing up that leaky gut with substances like glutamine and quercetin can be useful. There's so much that can be done.
Yeah.
And there's a lot in my books. There's also a lot that can be done by just working with somebody and, picking it apart piece by piece, because it's not an overnight change that happens.
Yeah. And I really want parents and caregivers who are listening to come away from this talk too with all this stuff, but also how, those behavioral things and issues that kids have to deal with, like pooping in their pants and all those things really affect their sense of well-being, their sense of self, their self-confidence, it affects their self-esteem. They can be ostracized in their groups of friends, or, like they have a hard time making friends, or, all those things, family issues, don't get along with mom, dad, siblings, people don't want them around, right? That one child was asked to sit outside at a party. How humiliating is that? And that, a lot of that is related to what we're feeding them. And so that's huge. I think that's a huge deal. I mean, leading to depression and all kinds of things that can really be helped by keeping their digestive systems healthy and by feeding them things that are good for them and not feeding them things that make them kind of, have an epileptic seizure on the floor, right?
Yeah, I also do work with the Autism Research Institute, and they keep parent records on what seems to work for kids in terms of pretty much every therapy that's used. And
Mm-hmm.
the two therapies that consistently get the highest ratings by parents are using antifungals for yeast overgrowth. And the other thing is the diets. The diets, like specific carbohydrate diet, gluten-free, casein-free diets, more than 3/4 of the kids have significant or major improvements.
Wow.
And so when we look at it, and it's not just kids, I can't tell you how many adults that I've worked with who go on a sugar-free diet. Just
Mm-hmm.
that one thing alone, they lose weight, their depression lifts, their arthritis goes away, their energy improves, their sleep improves, you know, or going on a gluten casein-free diet. So if you're planning on on working with your kids' diet, I encourage the whole family to
Yeah.
go on the same program, because what you'll often see is it's the mom or the dad or one of the siblings who actually gets even better results than the kid you wanted to work with in the first place.
Yeah, I've seen that happen actually. Yeah, fantastic. Okay, so we're talking about the problems of digestion. What actually, besides bad food, what can also cause poor digestion?
Not chewing our food,
Yeah.
not having enough hydrochloric acid in the stomach, the pancreas either not manufacturing or not releasing enough digestive enzymes.
Mm-hmm.
And when we have a leaky gut or when we have damage to those microvilli, we have a hormone there called cholecystokinin that releases from the tip of tops of those microvilli, releases and sends a message to the pancreas and says, hey, we need some digestive enzymes here. So if there's any damage to those brush borders and they really look like a toothbrush, if there's any damage to those, then that's not going to happen. And also, if there's any damage to them, we also don't do well with lactose or fructose.
Mm.
Let's see, not having just the right nutrients, as we mentioned magnesium before, the right fats. I mean, overall, it's like there's not just one thing that affects how well we digest our food.
Mm-hmm. Okay, it's definitely a combination, and you know, a lot to do with lifestyle. Yeah. Okay. So, and we can't leave a conversation about digestive wellness without talking about poop. Right? And so the poop can be a telltale sign of how well, you know, your child's digestion is performing. So can you just give a little rundown about that?
Well, we've already talked about constipation and diarrhea a
Yes.
little bit and about frequency. The texture and consistency of poop can vary depend on what you've eaten. If you've eaten a lot of really high fat foods, then it might float,
Mm-hmm.
because remember, fat floats on water.
Mm-hmm.
So if you see floating stools and you see those consistently in your kids, you know that they're probably not digesting fat that well,
Mm-hmm.
or they're eating too much of it that their body can't digest it. If you see a really pale, kind of tan looking, and almost frothy looking stool, that means your child is really having problems digesting and absorbing fat.
Mm-hmm.
The ideal poop should look like a brown banana. It should come out pretty quickly,
Mm-hmm.
in a matter of seconds. It's just like whoosh, out. And if it's all balled up, then probably your stool has been sitting in your colon too long,
Mm-hmm.
because it means it's gotten dehydrated. If it falls apart, maybe you went through too fast. Maybe you just ate a ton of fruit or something. So you have to look at that. And again, there shouldn't be any pain involved with it. It shouldn't be an issue in your life. And most stools will be dark brown, medium brown. If you've eaten a lot of greens, they might be green. If you've eaten a lot of beets, they might be red. You don't expect to see a lot of undigested food in the
Mm-hmm.
stool. In small kids, if they're not really chewing that well, you might, but you don't really want to see a lot of undigested food in the stools. You might see something like a tomato seed or sesame seeds or something like that,
Mm-hmm.
but you don't expect to see recognizable food, blueberries in a stool.
Would you recommend just having a Googling the Bristol stool chart? Do you use that at all?
I do. That's a good one.
Yeah, you know what? They sell t-shirts and mugs that have the stool chart on it, in case you're interested. Only weirdos like me would buy something like that, though, maybe.
Even I'm not going to wear a Bristol stool chart.
You're not? Oh, I was going to send you one. Okay, that'll save my money. Okay, so, let's wrap up our talk. Just a little overview about what we can do to ensure the health of our children's digestive systems. And so you mentioned food choices, higher fiber, make sure we're getting good water, not dilute your food too much with a whole bunch of liquid, and slowly chewing, eating, gratitude before meals, reducing stress. And then what about a couple of other things like, reducing chemical exposure, things like that you could add to that list?
Well, I think I've already talked about chemicals a little bit. One
Yeah.
of the things that I would add is family meals are so important.
Mm-hmm.
It's really important that as often as possible we sit down as a family and we eat a meal. And, as many times a week as you can. The family meal has been demonstrated to improve communications. Parents know when their kids are kind of wobbling off track. There's less drug use, there's less delinquency, there's better grades. I mean, in every possible way, family meals benefit us. And so that's a really simple and good first way to start. And the other thing is for those of you who are thinking about getting pregnant or have little kids, use of probiotic supplements during pregnancy while you're breastfeeding. If you're using formula, putting your finger in a little jar of baby probiotics and having your baby lick your finger, so important. You know, it's because we want to set up that gut microbiome in the first 2 years.
Mm-hmm.
And if your child has an ear infection, which is the most common reason why we give antibiotics, then what you need to know is that the American College of Pediatrics does not recommend treating ear infections with antibiotics unless it's a middle ear infection. And there are lots of natural things that you can do. There's homeopathics that work amazingly well. There's also using mullein, comfrey, garlic drops that you can buy in any health food store. There's mullein oil drops that have a variety of different things in them that can be really helpful. And even something that I used to use with my kids, we would swim in this bay that wasn't always that clean. And so we would just take equal parts of peroxide, vinegar, and rubbing alcohol, and I would just use those drops and put them in their ears. And it helps prevent ear infections. Looking at if your child has repeated ear infections, taking them off dairy, looking at food sensitivities, really working with that rather than just jumping to antibiotics.
Mm-hmm.
I think, I gave a lecture last night, and one of the women said that her daughter in the first 5 years of her life had so many ear infections that she was just put on antibiotics over and over and over again. And by the time she was about 15, she was diagnosed with Crohn's disease, which is one of those inflammatory bowel diseases like ulcerative colitis. And, we see over and over that a lot of kids who have been treated with antibiotics over and over really get in trouble later in life because they didn't set up this microbiome correctly. So I think first things first, and to take it back even further, preconception planning is so important. Here in the United States, according to the Center for Disease Control, 1 in every 55 children is now diagnosed with autism. And over 10% of our kids are diagnosed with attention deficit. It's as high as 20% in some states. So when you look at all of that and you start thinking, wow, what if parents detoxified before they got pregnant?
Mm-hmm.
What if parents really stopped drinking and smoking pot and really cleaned up their diets and started exercising? And before they got pregnant, they spent 3 to 6 months just optimizing their own health. Don't you think that could optimize the health of the children? And there are autism doctors who are doing just that, and they're not seeing subsequent children in their practices developing autism or attention deficit. When you start seeing a baby who has colic, that's the time to intervene with some probiotics and to start looking for food sensitivities. We don't have to wait all the way until we see a child who's been diagnosed with a more serious condition. So, I think being more preventive, being more proactive, these are things that I think are really going to change the health of our kids.
Excellent. And so, I think that all of this stuff, this is a lot of information for parents and caregivers to take in. And, but I think that your books, Digestive Wellness is in its fourth edition. Is that correct?
Correct.
Yeah. And so, more specifically, Digestive Wellness for Children has a bit more information just specifically about children. So I think these books have, all of this stuff laid out, issue by issue. It has all the explanations that you gave today and much, 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 much more. And also, it also talks about, or they also talk about some testing that people can do and seek out, working with their own practitioners or their own doctors at home to really identify maybe some of the issues that they might suspect that their children are having or they're having themselves. So really, I find your books are just like a hugely informative and wonderful guide to in this journey toward digestive wellness. So please do, everybody, check out those books. And Liz, is there anything else you'd like to share about your current projects, anything that's coming up for you, or any other ways that people can get in touch with you and the work that you're doing?
Sure. Well, if you're interested in getting a master's degree in integrative nutrition,
Ooh, yay.
I would encourage you to check out Maryland University of Integrative Health. Our website is muih.edu. It's a 2-year program. You can do it on campus or you can do it distance learning, or a mix of both if you'd like to come to Maryland but mostly want to stay home and do it. We have a postmaster's certificate program for nurses and psychologists and MDs and other health professionals who just want like 15 credits of nutrition to really know how to use nutrition in what they're already doing. And then we're developing a doctoral program for January 2015 that's not quite ready for prime time, but we're working on that. So if you want to go back to school, there's some great options for you. And then I have a free website called Access to Health Experts that has interviews and lectures and handouts and all kinds of free information there. So if anybody's interested, and then right now I'm actually registering people, nutritionists and health professionals, for my mentoring and advanced nutrition forums that'll begin in the fall. So lots of things that I'm involved with right now that people can tune into. My other website is innovativehealing.com.
Awesome. Thanks so much, Liz, for all your time, expertise. That was just fantastic. And I'm so glad that you have been part of this summit with us. So you take care and have a wonderful day.
Thanks, Carla.